I think now it's time for us to transition to the internal exam.
Yes.
I feel like this is the part of the exam that gives the most anxiety, but it's the most important part because we gather so much information. And I don't know if some women even know what we are looking for when we are looking internally. And so I think this is a place for them to be able to come and say, okay, that's what they're doing. And also to be able to advocate for themselves if it doesn't feel right or if it feels uncomfortable so that their provider is able to change things up. What do you think?
I agree. I think because it is the part of the exam that most people feel anxious about,
Yes.
it is important to talk to your patient throughout the exam. Everybody starts their exam differently.
Yes.
How I start my exam, I always touch the person's leg just to let them know that I'm making my way down so that they don't feel startled by just going towards the center. That can make people feel really anxious.
Yes. And also let them know it's going to be cold, right? Because I
Yes.
feel like my hands is going to be cold to touch, and touching those inner thighs, inner legs is making it my hands down to their vagina before we insert anything into them. And then we often do like a speculum or a bimanual exam. And I feel like you said, it really depends on the provider. What do you normally start with?
I always start with touching externally and doing the external part of the exam. When it's time to move internally, I insert the speculum.
Yeah.
And I take a look and visualize. And then you're going to go and you're going to run any tests that you need to do. And then when the speculum comes out, and we'll talk more about what we do during the speculum exam, I insert my fingers and do the internal bimanual exam.
Yeah. I think when we talk about an internal bimanual exam, a lot of people say, why do you have to do that? I have some women that are okay with the speculum going in, and then when I have to insert a finger or two, they get a little bit more nervous. And I explain to them, I am feeling your uterus. I am feeling to see if I can feel your ovaries or the sides of your ovaries, which are the sides of your uterus, which we call your adnexa, to see if I feel anything that is abnormal or enlarged that shouldn't be there. And I also explain we are feeling the local structures. There is your bladder that sits above your uterus and your rectum. And so those are things that we can be feeling for any abnormalities.
Absolutely. There's no test for ovarian cancer.
Yes.
So that's one of the things we're feeling for when we insert our fingers. We're trying to feel along the sides of the uterus to see if we see or feel any large masses pop up.
Yes, I agree.
So now it's time for us to talk about exactly what happens on the internal exam.
Yes.
So we know that we have speculums. Now for people that come in that have never had their pelvic exam, you know what I love to do?
Yes.
I like to ask them, would you like to see the speculum?
I do the same thing.
Oh my gosh.
Absolutely. Yes.
Sometimes they're horrified.
Yes. And I'm like, you should, if you've never seen it, I encourage them to at least let me show you what is going to go internally.
Absolutely.
Yeah.
Some people are like, nope, I don't want to see. Just put it in, just do the exam. Some people are like, yeah, I want to see. I want to be more educated and knowledgeable. So I always pull out the speculum and I show them what it looks like, that it's metal. And then I like to show them what I'm going to do.
Of course.
So I'll say, I'm going to insert this into the vagina like this. And then you're going to feel pressure. And then I open it up so I can see exactly what's going on down this little area.
Yeah. And I also tell them, I also have a metal speculum in our office, but some people may have the plastic speculums in their office. They also may have a plastic speculum if they go to the emergency room or urgent care center, things like that, because this is easier to use and more disposable. So I also show them it works the same way. It comes in different sizes. And again, you may hear more noise. And that's one thing I don't like about these is because that noise can cause a little bit of anxiety versus when you're using the metal speculum, you don't have as much of that. And we have a tab here as well that gives us light. So some people like it so that we can actually see and shine light of where we're going. I don't know if you all can see that a little bit.
Absolutely.
So, yeah. So this is the speculum that everyone is a little bit nervous or anxious about having, but there's different sizes. It's not a one size fits all approach. And we can always downsize or upsize if needed.
Absolutely.
Yeah.
Look at these two different speculums.
Yeah.
This one is called a Peterson. This one is called
a Graves
speculum.
Yes.
So these are the two different speculums that we might use during your pelvic exam.
Yes. And I think the one thing that everybody thinks when they're getting an internal pelvic exam is that they're getting a Pap smear. That is not the case.
No.
Just because, and I believe we talked about this a little bit earlier in the episode, that a pelvic exam and a Pap smear is not equivalent. A pelvic exam can include a Pap smear, and usually when we have these in for a longer period of time, usually it's because we're getting a Pap smear or some type of internal swab so that we can evaluate whatever condition you may be presenting to the office for. All right, so now our good Q-tips. So when we're doing a Pap smear, we have different materials that we could use. I call this a paddle, is what this is called. So this is usually an end of the stick that we can use to get cells from the internal part of the cervix. Were you going to ask something?
No, you call it a paddle.
What do you call it?
I call it a spatula.
Okay. I call it a paddle. My nurses that be helping me, I'm like, can you grab me the paddle? I call this the paddle.
It works. Either name works.
So the spatula, the paddle. I don't know what it's a paddle. I call this a broom.
Yes.
Okay, you call it a broom too? Okay. You ain't calling it a mop.
No.
It's a broom. So I call this a broom. So we often use these two, the spatula, aka Dr. Coates paddle, and the broom to help stir up or get some cells out. And then we have what we call
the cyto brush.
Yes. And that is what we use to collect the last part of the cells after we're getting tissue. And when in my office, I do something similar, how you show your patients the external exam using your hands. I also show them what their cervix looks like. It looks like a little bit of a donut. And that's what I show them. I make a fist and I show them, this is what it looks like and where I'm going to be swiping internally inside the internal part of their cervix to obtain the tissue, obtain the Pap smear. So that is normally how I will explain it to my patients before we have it done.
Absolutely.
Yeah. What's up, y'all? I am so excited for you all to be watching our channel. Don't forget to like as well as subscribe. All right, let's get back to this episode.
So one of the most important things that we need to talk about really is what is the Pap test? Because like you mentioned, when people go to the emergency room, they are definitely not going to get a Pap test.
No.
You think that a pelvic exam is equivalent to a Pap test. That is not true.
Absolutely
and it can
not.
really leave you vulnerable and thinking that you've had all your necessary testing and screening that should have been done and you did not get it done at all. It's very dangerous.
I tell patients there is only a subset of doctors who are going to do your Pap smear at your exam. And usually they should say that term. And that is usually your obstetrician, gynecologist, sometimes your family medicine doctor. And usually those are the only two. You really don't see that at other primary care physicians like your internal medicine physician, but your primary care and sometimes your family medicine. And a lot of times family medicine physicians send them to your OB/GYN. And I think that's perfectly fine. Just making sure that you understand that a swab that is done and a Pap smear that is done are completely different.
Absolutely. So we should talk about how that's collected.
Yes.
Because you may see just a regular Q-tip on the counter and you may not see some of these other things. And you really should be putting two and two together on like what kind of tests are going to be done for you during that visit when you go into the room.
Absolutely. So you want to start with our easy one, our swab?
Sure.
Okay. So if you see this swab, this is usually to detect for an infection, whether that be a bacterial or fungal infection. Sometimes the Q-tips could be a little bit of different size, but this is a general swab. Some of those infections could be sexually transmitted infections, sometimes not. And so this is most often what a lot of primary care providers are collecting, and that does not necessarily mean a Pap smear. Okay?
Absolutely. Next part. This is the spatula, or
AKA the paddle.
The paddle, where we actually use this on the face of the cervix and just swipe the face of the cervix to get cells.
Yes.
So that is a spatula or a paddle. Yes. And then this is a broom.
Yeah.
I
often use, I know we say a lot of people do things differently, so I often use the broom and not necessarily a paddle.
No.
Yes.
You use this by itself or you use these two in conjunction together.
Yeah.
So this is the paddle or the
spatula.
Right? And then this is the cyto brush.
Yes.
This is the brush that actually goes into the cervical opening and then you swirl it around and you get cells high up to the cervix that you can't visualize or that you can't touch or access. So you do put that up into the cervix.
Yes, I agree.
Now, the Pap test is so important because what does it test for, Dr. Coates?
It's testing for cervical cancer. The goal is to see if there's any precancerous cells or cancerous cells that could be already present. And so that is the main purpose of getting your Pap smear.
And the beautiful thing is that cervical cancer usually takes a decade to develop.
Yes.
So having your Pap test is important to do it routinely because they're going to pick up precancerous lesions or dysplasia. That's another term for it. And they're going to be able to detect those cells. And if they are there, then you can treat and you can head off that 10-year window of cancer developing. That's why you've got to go see your OBGYN.
Absolutely. We are wanting to push back the diagnosis of cervical cancer. It's because we're trying to prevent women from getting unnecessary procedures than what they need.
Absolutely. And I'm older than you. So when I was younger, you were supposed to get your first PAP like 2 years after you started sexual intercourse. So things have evolved very rapidly through our lives and definitely through our careers. And through our training. So now what do we do for Pap smears?
So now, unless you have specific medical problems, and I'm not talking about people who have HIV, that's a subset population. But if you are no other medical problems like HIV, then the recommendation is to screen at age 21. And at age 21, the recommendation is for Pap smears every 3 years, up to age 30. And then how do we change things?
So at age 30, you're going to get your Pap test along with the human papillomavirus test. So it's the HPV test that detects the virus that causes cervical cancer. So if you don't have that virus, your risk of developing cervical cancer is very, very low.
Absolutely. And so when you're at age 30, a lot of your doctors may only be doing the HPV plus the Pap smear testing tissue sampling that we talked about every 5 years. And that is okay. That is normal. And so a lot of patients say, I don't think my doctor doing this right. And I'm like, that is the recommendation based off of our professional societies.
And part of that is because, like I said earlier, that cervical cancer takes about 10 years to develop. So it's not something that drastically changes from year to year, especially if you're negative for the HPV test.
Yes. And the other thing is a lot of people are concerned about the HPV testing and what Dr. Franklin just explained. If you are not HPV positive on these tests, then that's why we can increase the year-long length to 5 years, because the likelihood of you getting cervical cancer without being HPV positive is less than 0.1%. 99.9% of cervical cancers are associated with HPV. And so that is the biggest point of why we've moved toward testing in that way. We have many episodes that's going to come up and talk about Pap smears and cervical cancer screening. We can't get through all the things here because we also have to talk about vaccines, all the amazing things. So I think that's a good way for us to kind of make sure we know why you're getting screening, when the time is to start it. I guess we could say the stopping point. 65 is usually the average age of when we say to stop, unless you have a medical problem that should prolong it, or unless you had an abnormal Pap smear or screening that puts you at a higher risk.
Absolutely. And that should be discussed with your doctor at your annual yearly visits.
Yes. That's why you go to them. That's why you get them annual pelvic exams.
All right, guys, this was a lot of fun.
It was.
We love talking with you all about all these different topics that we're passionate about.
Yes.
Please hit that subscribe button, the like button, come back and see us. Let us know what topics you want to hear.
Yes. Hopefully we didn't scare y'all away with our Pap smears and our speculum exams, but we know that these topics are really important, but we want to hear from you all too. Let us know what you would like to talk about, any topics that you feel like you haven't gotten the education that you need, or you just need some clarification. That is what we have this platform for. We want to engage and connect with you.
That's right. The Real Stethoscope Diaries. Come check us out.
Please do. Follow us on Instagram. Like, follow, share, subscribe. We look forward to chatting with you guys next time.
Peace.
Bye.